Kitenge, NTV.
Je, wewe uko kadi? Now, for thousands of Kenyan women, menstrual pains is not just a monthly inconvenience. It is a constant life-altering condition that often goes unseen. Endometriosis, a chronic and debilitating disease, frequently remains undiagnosed or misdiagnosed, leaving patients to endure years of suffering and financial strain. Health experts say that many patients wait 7 to 10 years for a definitive diagnosis, as NTV's Margaret Kimathi now reports.
Jacqueline Jerry from Kagio in Kirinyaga County says her struggle with endometriosis began in 2017. She experienced painful menstrual periods, persistent backache, dizziness, and shortness of breath. As her condition worsened, she sought medical attention and was diagnosed with tuberculosis.
I took medication for the first 6 months. Later on, they gave another 6 months, thinking that I had skipped the dose.
She was placed on treatment and for 2 years adhered successfully to the medication, holding on to hope for relief that never came. The medication even led to further complications.
By that time, I had pleural effusion, which is caused by endometriosis. Ilikuwa natolewa maji kama lita 2, lita 3 kwa kifua. Na ilikuwa ina take like 2 weeks, 3 weeks. Nakuja natolewa tena. Tunaitanga tapping. So hiyo maji ndio sasa ilikuwa inanifanya nikose kubreathe.
It was until 2025, 8 years later, after her symptoms began, that she finally received the correct diagnosis.
Nikaenda kwa Dr. Jojage through Dr. Crowd. Nikapatikana it was a thoracic endometriosis yenye ilikuwa imeaffect lung, and nikaplaniwa for surgery at Third Park, Nairobi.
Endometriosis occurs when tissue similar to the lining of the uterus grows outside it, affecting organs such as ovaries, fallopian tubes, bladder, and even in rare cases, distant parts of the body. The result is chronic pain, heavy menstrual bleeding, fatigue, and for many, infertility. Endometriosis affects 1 in 10 women of reproductive age globally, about 190 million people according to the World Health Organization. Yet in Kenya, it remains largely invisible.
Their delay could be anywhere from 10 to 20 years. And one of the main challenges, of course, I know it's a global problem, but I think in Africa it's even worse, is access to diagnosis and access to treatment. Because treatment for endometriosis, especially surgical treatment, is quite extensive. Because delayed diagnosis would mean the patient are going to suffer, effect of endometriosis for a very long period of time. And one most feared is, like, what we mentioned, one surgery that we have on Friday, a patient who has lost her kidney from endometriosis or infertility.
Officially open, yay! Discussions on how to address the condition are taking center stage at the Healing Mama Africa Endometriosis and Oncologic Bootcamp, currently underway in Kirugoya. Hosted by the African Center for Endometriosis, experts highlighted the lack of medical specialization as a major barrier, while offering screenings and surgeries for 20 women with endometriosis.
Endometriosis has to be managed by endometriosis specialists. And in most cases, it's going to be multidisciplinary team. So it's not a one-man show. It's not only for a gynecologist. And this is what we are now promoting. That's why you see here, we have, different specialization from imaging to surgeons to urologists. Because we know that endometriosis can affect just any part of the body.
It's not just any other disease. It actually messes their life and turns them upside down. Many of them going into suicidal tendencies. So once these women feel heard and we are in a position to now see how to help them, I think the whole narrative will change soon.
The high cost of diagnostic scans, surgery, and long-term therapy makes treatment a major barrier for women with endometriosis.
Juu kama yangu cost ilikuwa 1.3 million na SHA ilisimamia 300 peke yake. The rest was cash.
Njeri is now 1 year post-recovery after undergoing 2 surgeries. Experts warn that lack of reliable national data on endometriosis undermines policy and funding and have called on the government to provide accurate information to better support affected women.
A few centimeters.
Margaret Kimathi,